y'all can hear me. But I want to thank you all for coming. To me, this is and whether you're for it or against it, as they say down south, I'm from El Dorado, that's my home. So I really feel like I'm at home, and I'm actually going to leave here and go visit my dad, who's 88 years old, and still living there with his 88-year-old sister, my aunt. So I felt when Terry and them asked me if I could come, I was like, sure, I think you go home too. So that's real great. I thank you all for coming. This is truly an amazing piece of legislation. And I just want to preface my talk first to say I am the executive director of the Arkansas Minority Health Commission. However, my appointment by the governor and my board of directors with working with legislators is we work for the health of all Arkansans. And the way my board views it and the governor views it is when we look at the poor and the rural and those who are disenfranchised, which many times are minorities, when we help those individuals get connected, we help to improve the overall health of all Arkansans. And our statistics look better because we look at those who sometimes can't reach those things as easy as others. And we find that in rural Arkansas, there's many people just like down south here who are just disenfranchised. And so that's my job. My job is not just to help the black folks or the Hispanic folks or the Indian or Asian people in the state. And my job is to target them and focus on them, but I keep a keen eye for all of us because all goes one, goes all. That's the way we really look at it. I just want to preface that I have a background in minority health disparities, but my goal is to see all of us live a healthier lifestyle. And I'm honored to be asked by the Arkansas Insurance Department. I'm one of several speakers in the Speakers Bureau that go around the state, and literally I'm doing about 2 or 3 of these presentations per week. I was in Crossett Saturday. Before that, I was in Blytheville on Thursday. And so you can see we're getting around the state. Why? Because this is so important. I want to start out first also by saying this is an interactive conversation. This is not for us to come and just tell you how it is, but we want to hear back from you. Terry, working with the Insurance Department's Communications Department, she'll be taking notes. We'll be writing down the questions that are important to Columbia County. See, I know where y'all are. Columbia County, you're right next to Union. But we'll be writing down your questions so that we can take those questions back. If there's a question we cannot answer, I'll be honest about it. We don't know everything right now. There are things that are being created, that are being designed in September that we have no clue what the answer is today, but we will know come September 5th, come September 15th, and surely they'll know by October 1st when all this has to go in place. And I saw your face right there, but there's some things they probably are not going to know by October 1st, but this is new, and so with anything new, we've got to all be patient and be ready to try to figure it out, because the bottom line is that it is the law right now, and unless our legislative body changes it, which many of you probably know that it took a bipartisan effort, January through April, to create and to allow this law to be passed in Arkansas. It took a supermajority vote, which means 75% of your legislative body here in Arkansas had to vote for this to occur. And with the legislative body now being 51% Republican and 49% Democrat, it was not something that the Democrats did on their own. It was something that they all looked at and said, how can we come to a resolution, because we all are concerned about the poor that lives in our community, about those who, and here's the key to this, is that it's the working poor. It is not people who are not working. It's the working poor who, for lack of being able to pay your light bill, how many of you know of people who work 2 jobs but still can't afford health insurance? I have people in my family that are like that, and it's not because they don't want to buy it and they just want to, run up the uninsured bills at the hospital emergency rooms. They just simply can't afford it. They're determining whether they're going to buy food, keep the lights on, buy the clothes for the kids to get back to school, which they're running to hundreds of dollars this time of the year for parents. They're looking at all of those kind of things, and many times, if they're feeling good, the health insurance just comes to the side. Well, this particular law basically now says that every American must have health insurance, whether it's through your employer or whether it's through the health insurance some will qualify for it, they don't qualify for the marketplace, or whether it's, of course, Medicare. When you get over 65 years old, you have that option there available for you. So why don't we just begin, and as I've talked about, most of us know of individuals who do not have health insurance. Most of us know of individuals who want health insurance but for whatever reason cannot afford it. And so in Arkansas, right now, Terry mentioned the number of 572,000, and then I've seen some numbers that say 560,000. So just to make it simple, we'll just say we know that over 500,000 Arkansans right now do not have health insurance. And so this is what this particular law is looking at, are those people from 19 to 64 years old who do not qualify for health insurance or simply cannot afford the premiums that are currently there. They probably could walk into Blue Cross Blue Shield and sit at that table and say, I want to sign up for insurance. Or they probably could walk into any health insurance agent's office right now and say, you know what, I know it's good for me and I need it, but they probably at the end of that conversation, when the premium costs come back, they're probably going to say, I need that with you on that. And probably never get back because they just simply can't afford it. That's what this law is talking about, those from 19 to 64. Why do you think it's not talking about folks from 18 on down or 19 on down? Our kids. Our kids first in Arkansas covers the majority of our children. And so this law really isn't, even though some kids that aren't on there now or don't have our kids and can't qualify for it, they will likely qualify for health insurance through the marketplace. So we do anticipate picking up some of those kids that aren't currently insured because it now expands the poverty level from Arkansas's pitiful little 17%. You literally have to only make two right now in order to get any kind of Medicaid. Your parents have to make like $2,000 a year. And, or, you know, I tell people all the time, right now in Arkansas, you have to be almost dead in order to get Medicaid. We really have just a very small percentage of our state citizens who are on Medicaid. But our Kids First really, really has been a revolutionary health program for the children. Why do you think it doesn't apply to people 65 and up? Medicare. So our kids, between our kids and between Medicare, those people on the outer peripherals, this is not necessarily about you, although the seniors will have a benefit or two when it comes to the drug, the pharmaceutical drugs with the donut hole issue, and we'll talk about that. And although on the other end with the children, some of them will come on that aren't qualified for our Kids A and B right now because their parents' income under the current system is a little bit high. It really is talking about the majority of 19 to 64 years old. They're 500,000 plus. And so we tell people right now that as of January 1, when this law goes into effect, change is on the way. Boy, I feel like a little tremor was going on there. Thank goodness some earthquakes are happening. Like this little video, not bigger. Well, change is on the way, and it's a major change that is going to be happening. Give us just 1 second here. Here we go. Let's see what it's saying. Under the Arkansas Insurance Department, which the Arkansas Insurance Department is the major entity that is driving the ship for this whole program. So if you ever have any questions and you can't find numbers of folks that you meet like us, call the Arkansas Insurance Department and they'll be able to help you. They have, under this law, created a program called the Arkansas Health Connector. That term is something you need to remember because all the commercials you're going to hear on TV, all the ads you're going to see in the paper is going to talk about the Arkansas Health Connector program. And that Arkansas Health Connector program is going to help people get connected to the health insurance marketplace. And I'll tell you what the marketplace is in just a moment. And so you have maybe seen on TV, tell me, how many, just by raising your hand, and I like to do this kind of informal, how many of you all have seen some commercials that talks about Get In? Raise your hands high, because we like to see that. Get In. That's going to be, this is going to be kind of the signature television, you'll see it on billboards. That's the campaign that's going on right now. And so when you see that and you go back to your places of employment or you go back to your children and your families, tell them to look at that ad because it's actually going to connect them to the information that they're going to need to know in order to get connected. Also, it's important for us to know this. Terry knows this because I think, raise your hands again. We have maybe about 40 people in here, and maybe of the 40, there was about 8 or so that raised their hands. It's important for us to get your gauge naturally because we want to go back and let the insurance department know people are connecting to it, they're seeing it, or we may need to put a little bit more mustard in it so that we can make sure that people are going to get this information in this campaign. So let me tell you a little bit about the Affordable Care Act. As you all know, March of 2010, President Obama signed it into law. There was a huge court case that went along with it with the Supreme Court. In June of 2012, last year, the Supreme Court basically said it is constitutional and that you can require all Americans to have health insurance. However, the Supreme Court said it would be unconstitutional, however, to pull away all Medicaid funds from a state if that state chooses not to participate. So from there, it said, okay, it's constitutional, but you can't take away the 75%. Right now in the state of Arkansas, 75% of the Medicaid dollars that come to our state are federal dollars. 25% is put in by the state. So what the law was trying to say was, okay, we're going to force you to do it because if you don't do it, we're going to take away the 75%. And the Supreme Court said unconstitutional. You cannot do that. But you can require them under the taxing authority to get insurance. And so that put it back, and it said that would be a decision of each state to determine whether or not they would want to do the Medicaid expansion in their states. So in the state of Arkansas, January through April, that's what was happening with your legislative body, the governor going to Washington, D.C., working a deal out with Kathleen Sebelius, the Secretary of Health and Human Services, for what is called a private option. So not Medicaid expansion necessarily, what our legislative body did want to do, and we have to give them credit for this, what our legislative body said was, we really don't like this really, but we want to help the poor, and we want to help those people that are talking to us in our districts. But what we don't want to do is put all that into the Medicaid pot because that's a government program, and they want small government. They don't want big government, right? That's what our makeup of our legislative body is now. And that's a good thought. That's a good thought. But what they said was, okay, we don't want to increase that Medicaid pot necessarily, but we do want to offer this insurance to individuals. So what they came up with was what was called a private option plan. So that terminology is something you need to kind of hold on to because the private option basically, instead of the federal dollars that will come to our state now, going into the Medicaid pot, which will increase that pot, and what your legislative body was concerned about was, okay, the federal government pays 100% the first 3 years. And that's true. Every single dime that goes towards the insurance being paid here in our state for those who will qualify over the next 3 years, every single dime will be paid by the federal government. What your legislative body said was, what happens after the 3 years? And the law says that the federal will pay 90%, but the state has to pay 10%. What your legislative body in their wisdom said, what happens there if we put it in Medicaid and then that pot goes up? What we would like to see is that we put in a private option pot where that federal dollars that come in will go into the marketplace, what we talked about earlier, it'll go into the marketplace, and that those dollars will then be paid directly to the insurance companies, not our federal Medicaid pot being increased or decreased or all that. We don't want to do that. They said we want it to go directly to the marketplace, which is at the insurance company, not get a Medicaid card. They will not get and sometimes, you know, those things are stigmatized. When you go into the doctor's office, sometimes when you get that Medicaid card, you know, the doctor, they'll have a note up on the door that says, you know, can't take any more Medicaid patients, but they are taking private insurance. Well, this is going to be very helpful because now those individuals who get those cards through this Affordable Care Act will get a Blue Cross Blue Shield card, will get a Qual Choice card because of your legislative body's decision to create a private option rather than dump the money and create larger government for Arkansas and Medicaid. So that's kind of the I just want y'all to know a little foundation about that. But under the Affordable Care Act that was passed through your legislative body, everyone must have health insurance. So yes, everyone will be required under this law to have health insurance. The cost of insurance will be reduced for many people, and just by virtue of everybody being required to get insurance, the cost, the competitiveness, and the more people that are participating, the costs are anticipated to go down. We kind of give an example on that of if you have 100 say your total pot is $100, let's say, and you have only five people that's going to contribute. How much will those 5 people have to contribute each in order to equal the 100? $20. Okay, so you still have that pot of 100, and remember we're talking about all Arkansans, all Americans having to have insurance now under this new law. Well then if you put 20 people in there, and they're going to contribute to the $100, how much is the cost then? $5. Yeah, I had to think about it too. And then if you put 100 people into that pot, then how much does the cost become at that point for each individual? So $1, so it's a very simplistic way. Certainly it's not as seriously a hypothetical, but it's just a simplistic way of saying when everyone has to participate, the cost reduces. And that was the point that the Affordable Care Act was trying to make from its very initiation. And then the financial assistance is available. Many people are going to actually qualify for subsidy based on their income for their insurance to be paid for. And may only have to contribute a very small amount, or even some will have to contribute none, depending on their income. There will be a financial penalty for those who go without health insurance. So you say, well, I'm an American, I can do what I want to do. Sure you can, we all can. You know, we're an American, and right now they tell us that we have to have car insurance. And oh my God, my son is 17, and I just had to put him on my car insurance. I thought I was paying for another little baby or something. You know, I'm like, wait a minute, this kid is supposed to be growing up, but my insurance went up almost $300 a month. And but you know, so I really wanted to say, son, and I don't want to pay that. And why do I have to do it? But guess what? My legislative body in Arkansas said you have to do it. And if you don't, you'll pay a penalty. And then your insurance goes up and all that kind of stuff. So it's very similar to that. Everybody will be required to have health insurance, and if you don't, there will be a penalty, and we'll talk about that penalty in a minute. What are some of the current benefits that are available right now, that people are receiving right now? Right now, children under age 19 can't be rejected due to pre-existing conditions. Right now, children can stay on their parents' insurance up to age 26. How many of y'all knew that? Up to age 26, which is wonderful. And that doesn't even matter if they're married. If they're married and they're your child, and they're 24, and you want to put them go on yours because it's cheaper for you can still do that. It doesn't matter if they live with you, if they don't live with you. You can still keep them on your health insurance till age 26. Preventive health services are available at no cost to consumers. Mammograms, colonoscopies, physicals, preventive care services. Right now, there's no co-pays that people pay for it. For an example, I went into, my kids are all in sports, and so last year, we went in to get their physicals. And I was very well understanding I'm going to pay, $35 per kid for my co-insurance. And so I'm just going through it. My kids all help me, and I got my little paper so they can take to the volleyball coach and the basketball coach and everybody else's coach. And then I went up to the desk, and I'm ready to pay, and I get my little book out or my debit card or something. And the lady, she just looked there, she turned around, she gave me a piece of paper, and then she said, thank you. And she turned around and started continuing to work. And I stood there and I said, got back, I researched it, and it was a direct result of the Affordable Care Act that in 2010, people did not have to pay co-pays for the preventive health services. And there will be no lifetime limits on health benefits. Does anyone have questions at this point?
Who makes up the difference in that?
Who makes up the difference?
Like for a hospital that does a mammogram or preventive care,
Mhm.
there's no copay, and the patient usually in the past paid the copay, where does that money come from so that the hospital, the healthcare provider does not work?
Mhm. I mean, it's all a part of the idea of more people paying into the system, the cost being lower, and some services through this being eliminated because of that. What we do know is that people are still paying for it now. You know, the cost of things right now that the individual can't pay for, folks are still are paying for it even now. You know, someone's going to pay for it, and somehow I think what's happening is that because of the more people that are going to be involved with paying into the insurance pot, there's some services that will not have to be, that these types of costs will not have to be incurred. I don't really, and I'm going to be honest with you, that question is one that is asked everywhere we go.
I'm a hospital administrator.
Yes, and so I can imagine that's your main question. And so Terry, we probably need for this group, and I really hope that everyone signed in, because we will literally get back into the questions you have. If we can't sufficiently answer it, then we'll make sure that we get it researched and we will send you the official answer. Because it's important that we give good direct information. And as you see, I struggle with that a little bit because that's not my forte really is the cost factors, but there are individuals who literally look at that. We have in Arkansas what's called a consumer assistance committee, and folks, and I sit on that committee more so because the people I have to work with are the grassroots communities. So I have to be, but we also have a group that's called the plan management, and that's the hospitals, that's the healthcare providers, that's the Medicaid folks who are working, that's the insurance companies. And so I think that I know that there is a very good answer for you on that. And so we will work with that group to get that specific answer to that. But you're right, someone's going to pay for it. Now, there's no joke about that. We know that someone's going to pay. Absolutely. But someone's going to pay for it. Now, I know for hospitals, UAMS was a huge testimonial at every meeting. They had to usually be at all the meetings with those uninsured costs that you guys pay for continually through the emergency room and other meetings. Yeah, yeah. And many of the hospitals, yes, many of you guys were there at the legislative bodies, but we know that the funds that will go to the hospitals because of the Affordable Care Act, and I don't know what that full pot is, but the hospitals will be assisted for those uninsured costs. I don't know the percentage, don't get it too deep because I know that in a minute. But I'm saying that I know that there are some costs that hospitals are going to get relief on because of this. More than likely, that same relief is going to come for those types of costs that are not being paid for, what we're seeing that are not being paid for by the consumer. It'll probably be in there. But Terry will get that question, and we'll make sure that we respond back to you. Anybody else? So why don't we just go on to the next? Coverage begins January 1, 2014. Coverage for pre-existing conditions will begin on January 1. No premium increase except for age, geography, tobacco use or individual versus family coverage, and there will be no waiting period, meaning for some reason they think when we get older, you know, the older we get, I guess the more complications we get. I'm in my mid-40s, and I can tell you I got a few things going on, not too serious, but I'm looking at them because they stare me in the eye, and I'm having to work on them. So the older we get, sometimes the more conditions that come upon us. So your premiums, your age will be a factor in the cost of your premium. Tobacco use. We tell people right now that if you smoke or you know people that smoke, tell them to stop, because your premiums will be almost double what it normally would be if you were not a smoker. Because smoking, of course, brings on lots of other illnesses that adds on cost. So this law is giving an I thought was an interesting one, and I'm not sure of all the details about geography, but if you live in a more rural area, then the cost potentially could be higher. And they're saying maybe on the front end until it kind of all kicks in and everybody's kind of maybe a few years down the line. But of course, in your metropolitan areas of Magnolia versus Waldo, no, I'm just kidding. But El Dorado versus, Crossett or whatever, in those larger city centers, you're going to have a lower cost than people who are in Eudora or McNeil or what have you. I don't understand why that is, because for us at the, and if I can just put on my Minority Health Commission hat, lots of folks live in rural areas that don't have as much availability in their health conditions, are because they don't have as much availability as people in the more metropolitan areas. So why would their costs be more expensive? I don't know if it's to pay for the transportation getting there. I don't know if it's because their diseases have exacerbated because they haven't been able to see about it for whatever reason. But these are some of the issues that the Minority Health Commission, and not only us, Arkansas Advocates for Children and Families, AARP, this is a huge issue for us. We don't think it's really the fairest thing, but we'll keep our eyes on it, and as the legislative body deals with it, we'll see what we can do to help get those things changed. And no waiting period, meaning when you go to apply, beginning October 1, you enroll, it's going to set you up to begin immediately January 1 with your insurance benefits. If you happen to apply in Arkansas, the enrollment period for this first year is October 1 through March 31st. And what they said was, we've got so many people, 500,000 people that has to get enrolled, so we're going to allow a little extra time this first year. Whereas normally on your jobs and when y'all re-enroll for insurance each year, what do they give you, 45 days or 30 days, October 1 to October 31st to enroll or to make changes to your enrollment? It will be like that the second year, but this first year, October 1st, they'll give 6 months for people to enroll. And that's just to make sure that we get it. So if you happen to enroll February 1st, it'll be in real time immediately. Once you become eligible, it becomes real-time eligibility, and there is no waiting periods. So once you get enrolled, they get you in the system, they'll get you sent out that insurance card, and you'll be able to begin using it immediately. The health insurance marketplace, what is it? And we'll tell you more in a little video coming up here in just a second. But it's a high-quality health insurance plans will be made available in this health insurance marketplace. It's the only way to receive a financial assistance. So in order to get the subsidy or in order to get the advanced premium tax credits, they will have to go through the marketplace in order to get that. It's convenient, it's an affordable coverage, it offers affordable coverage and competitive prices, and it's really simple. We say that, but for a lot of people, it's not going to be that simple. And it's going to take, can you imagine a person who has never had health insurance, they're 31 years old, and they've never had to apply for it because they just never thought they could afford it. As a matter of fact, they know they can't afford it, and then all of a sudden they're being hit with these terminologies of advanced tax credits, co-pays. Who's the co-pay? Premium. We were at a town hall meeting in Texarkana or somewhere. I can't remember where it was. We was in so many places, but the lady said premium. She said, "Is that like a gas? I guess." So people, but what we're trying to help people understand is that this law is revolutionary and it's historic, but it's going to take a lot of show you this 5-minute little video that will capsulize some things that I've said. It'll share a few more things as well, and then we'll come back and talk about eligibility.
Ever been in this situation? You're searching for health insurance, but if a plan that works for you is out there, you sure can't find it. Or maybe you aren't even searching at all, because you think there's no way an insurance company would accept you, or no way you could afford a decent plan. It's no secret, too many Arkansans have been left out of any type of health coverage. Between expensive premiums and pre-existing conditions, 572,000 Arkansans are in inadequate health care. And a lack of health insurance is the only thing many of them have in common. We need a solution that can get more than 500,000 unique people health insurance that meets their specific needs. And actually, there is one. Arkansas Health Connector. Finally, Arkansans can get in and get insurance. Families are in. Children are in. Singles are in. Businesses are in. You are in. What exactly are you in for? Better health care and peace of mind. Here's how it works. Arkansas Health Connector, created as a result of the Affordable Care Act of 2010, will connect you to the health insurance marketplace, where you can shop for and compare insurance plans. To do this, simply enter your basic information and other details, even your preferred doctors when you enroll. You'll then be given the health insurance options that fit your needs. You can see what your premium, deductibles, and out-of-pocket costs will be for each plan, so you can choose the one that works best for you. Your monthly insurance payments or premiums depend on your yearly income and how many people are in your household. You may qualify for a break on costs through a new type of financial assistance called Advanced Premium Tax Credits. For example, a single parent with one child earning roughly $25,000 to $35,000 a year would pay somewhere between $90 and $200 each month. A married couple earning roughly $50,000 to $60,000 a year would pay somewhere between $395 and $475 each month. And a family of four earning around roughly $35,000 to $45,000 a year would pay somewhere between $110 and $215 each month. Some Arkansans will even be eligible to have all of their premiums paid through this financial assistance. The assistance you receive is unbiased and confidential. And again, the amount of assistance you get depends on your yearly income and how many people are in your household. Wondering if you're eligible? As long as you live in the U.S., are lawfully present in the U.S., and are not incarcerated due to a conviction, you are in. No more rejection due to pre-existing medical conditions. No more having to pay more because of past health issues. No more waiting periods. No more being left out of the coverage you need. The best part? By law, qualified health insurance plans have to cover what are defined as the 10 essential health benefits. This means preventive, wellness, and chronic disease management, prescription drugs, maternity and newborn care, pediatric services, including oral and vision, laboratory services, rehabilitative and habilitative services and devices, mental health and substance use disorder treatment, emergency room services, inpatient hospital services, and outpatient services are all covered. Several of these benefits aren't covered by most insurance plans on the market today, and a few aren't covered by any, yet each is essential to your health. This coverage will begin January 2014, but until then, there are several ways the Affordable Care Act is already improving health care. For example, it is now law that preventive care, like yearly wellness checkups, mammograms, and colonoscopies, insurance plans on the market, you can't be denied coverage and may be eligible for help with paying your premium, there's no longer any reason not to have health insurance. Finally, we're all in. Beginning October 1st, 2013, you can enroll online, by phone, by mail, or in person. So, mark your calendar and get ready to get in. The search is over. Go to arhealthconnector.org to learn more.
Which one you get. It's just sometimes people like Blue Cross Blue Shield qualifies. The service you always, or your family already had Blue Cross Blue Shield, you trust them better versus Centurion, or whatever the other companies are. Um, all of that is in process. They literally are just now, I think they made the decision on which insurance companies, but because this is a federal program that Arkansas just chose to partner on, they can't reveal who that is right now until the federal government has approved it. And so they're waiting for full approval of those that Arkansas has chosen, and that we should know, we understand from the meeting on Friday that I was a part of, we should know by the first to second week in September they'll know. But our understanding is that for the marketplace, they will generally offer the same thing. They'll have to offer the same thing.
So when it says apply in person, where?
Right. I think that's a great question. In person, all of your health departments in the state of Arkansas will have what is called an in-person assister and guide. We call them IPA guides, in-person assister guide. And so the health departments will have workers there. Your Department of Human Services, I think, will have employees there who individuals can go to. Your community health centers all across the state have been given even a whole separate pot of money than what the insurance department gets from the federal government. The community health centers would have in-person assistant guides that you can walk in there and say, hey, I want to sign up for this. And a person will be able to explain to you the benefits, explain to you the choices, but it will be the consumer's decision on what they get. So back to the lady in Hot Springs, you know, I can tell her what's in the basic cable package, and I can tell her what's in the premium package, but she will have to be the one to decide. That in-person assistant cannot say, you know, I think you'd be better off with the basic. They have to just give them the basic facts, and then let that family make their own choices, because we don't want them, and they're not agents, they're not supposed to be steering people. I can tell you the state of Arkansas, we have about 650 in-person assistant guides that will be hired through what they call in-person assister entities. The Minority Health Commission is an entity. We will hire about 12 individuals who will work high minority counties. And those individuals will literally be at churches. So this is outside of your health department, your, who else did I name? Wait, I should have been a teacher. Who else did I say? Yeah.
Community center, what are you referring to?
Community health centers, your community health centers. What's the community health center? Yeah, Haven Clinic. Haven Clinic. Pine Bluff is Jefferson Comprehensive Care. CrossFit, you have others. But they have their own individual name. They're community health centers. You can actually go on the internet, type in Arkansas Community Health Centers, and you'll get a whole list of all of them. So they'll be available. Then there's 26 other organizations, like nonprofits, that they hired or have entered, the insurance department has entered into an agreement, a contract with, to provide in-person assisters through their organizations, even outside of the ADH, DHS, and CHCs. We will have individuals that will work at churches on Sunday morning. My 10 folks will literally be at the church. They'll be at revivals, during the weekday. They'll be anywhere where folks gather. They'll be at the vacation Bible schools or whatever we need to do. We have a faith-based outreach because that's kind of the epicenter of the African American and Hispanic communities. They gather around the church. They gather around family food and stuff like that. So we'll actually, bring them all in and say, hey, let's do this thing, and we'll have people there that will be able to explain to them all of the plans, help them look at what's best for them, and then let them make those are agents and brokers, right?
Mhm.
So the agents and brokers, there was a real big political craziness about that. A lot of agents and brokers. And so they decided, yes, the agents and brokers should be a part of this. And so they will be able to still go to the Blue Cross Blue Shield and say, I want to know what's available for me under the Affordable Care Act. And they will have to, again, because they have a contract with the insurance department, they'll have to give them those plans opposed to the other sets of plans that they may have. They'll have to give them that information. You
Can
had a
they go
second part.
out, can they go out in order to be able to sell this stuff?
Agents and brokers, yes.
Okay.
Yes,
They do business as usual.
Business as
They
usual,
have-
just with a
Through
different
the
format.
marketplace.
Okay.
they have an active role. Also, Terry, what is the terminology for the person in the hospitals?
It's a CAC, it's a certified application counselor.
Certified Application Counselors, CACs. So you know how like right now at hospitals, an indigent person comes in and they're in the emergency room and they say, "Got insurance?" They say, "No, I got one back, but it's 60. Before you got insurance, I'm just kidding." But they find out that they don't have insurance, they get better, and they say to the family member, "Go around to the corner to this little office, and there's a lady there with Medicaid, and she'll help you fill out an application." Isn't there like that?
Not in small little hospitals, no.
Well, in some, when I had my children,
They're larger.
yeah, when I had my children in El Dorado, that literally happened to us where they, it wasn't me having a child, but we were able to go to an office when they didn't have funds, they were indigent, they were able to go to an office, and I can't remember what they call those specialists, but yeah,
Financial advisor or
so it's
something.
a similar type of person, they call them say it again,
Financial, like a financial aid or a
Yeah.
financial advisor.
financial advisor who would then point them to, depending on their income, whether or not they will be eligible for Medicaid, whether or not they'll be eligible for whatever other kind of program. That's the same type of thing that will be there with the CNC, what do they call it again?
Certified application counselor.
Certified Application Counselors is what they're calling those individuals that will actually be at hospitals to be able to take applications for individuals and see whether or not they're eligible for the marketplace versus Medicaid versus SHIP versus Medicare versus any other kind of program. So we understand that that's supposed to be a partnership with the hospitals that are coming along. But it's new, let me tell you something, happens every day, every day there's a new rule.
There's no
Yeah, but it's a
plans
new
to
program.
hire that.
It's a new,
That's just something we add on in
Yeah.
our job because we don't have any funds to pay hospitals.
right. Well, it's a new program overall, this Affordable Care Act, right?
There's a training process that goes along with that for those certified application counselors.
Right.
So they're still, they're still developing
Yeah.
all the stuff.
And off that, the in-person assisters that will be out there, whether it's through organizations like mine or other nonprofits that are participating, as well as those folks through the ADH, the DHS, and CHCs, by law, your legislative body, as they were implementing this in Arkansas January through April, they said, there's a lot of fraud that happens with this stuff, so we want to make sure that those people that are going to be educating the public about their choices are licensed, are certified and licensed. So as Terry was saying, they're right now, my IPA guys that we've hired are going through a week-long training, 8 to 4 p.m. At the community health center, the community colleges that the insurance department has contracted out with that educational institution to teach these guys through the training modules we've all created. And so they have to get licensed. And so if you see someone out and about and they are saying to people coming to enroll that they don't have that licensing and they don't have the Arkansas Health Connector logo on that license that you saw at the very beginning, you know that that person is likely a fraud. And so we're continually, this little logo right here is kind of what you're going to see on all things. No matter where you go, you need to look for that logo and know that that's the official logo and that they should have a license card through the state of Arkansas. We know that there's going to be fraud, and so your Surgeon General Joe Thompson and Jay Bradford, the insurance commissioners, they have implemented a system to try to reduce some of that. And if anyone asks you to say, if they ask your loved one, say, we can sign you up, come on over here to First Baptist Church in the thing, you have to pay us $25, it's just $25, and you're going to have health insurance for the whole year. additional information to do things with. So this eligibility, financial assistance is based on income and number in household. You saw that in the video. Citizens of the USA or lawfully present, they have to be a citizen. In Arkansas, of course, through our program, you have to be an Arkansas resident, not incarcerated, and undocumented individuals are ineligible. So some were saying, oh, this is going to make it where all the ineligibles or undocumented people get a chance to get in. They do not. They're not eligible for it. And so here's this family of 4. They gave you some examples in the video, but here's another example. A family of 4 with a household income of $45,000. That's husband and wife, both of their combined incomes and what have you. The monthly premium without assistance would have been $822. And so you can see why some people don't get it. That's per month. That's why some people cannot afford it. Their monthly premium, however, through the health insurance marketplace, if they qualify being at that level, family of 4, because it's based on the number of people in your household and your income, their premium assistance will only be $216. And so you can see why so many people are going to be more apt to take advantage of this, because the cost now becomes affordable, it becomes reasonable, and they'll be able to hopefully save, here in this example, $607. So the cost depends on family income, the number of people in your household. They're going to ask you about tobacco use, coverage you choose, individual versus the family. And by the way, individuals are eligible for insurance now through this. You know, if you were a male, right now, today, if you were applying for insurance and you were a single male, you are a single male, pretty much no type of assistance is out there for you. Even a single woman, if she's not pregnant, it's very difficult for her to get insurance. Now, financial assistance will be available to individuals. If they make $15,000, it's around $15,500 or less per year, they'll be eligible for insurance in the marketplace, and likely they will be eligible for their whole subsidy to be paid for. So some will qualify to have their premiums paid for them, and that's those who are from that 0 to 138% of poverty. But then when you get to 139% of poverty all the way to 400% of poverty, that means you're making a little bit more money. You will have to pay your premium, and you will likely get depending on how far you go up, your premium, there will be some tax credits that you can get with some assistance on it. But likely you're going to have to pay a great majority of your premium. But you will get some assistance, as same here. So choices, choose the plan that best fits your family. So you can't really say that, oh, the bronze is the cheapest and it fits everyone because it's the cheapest, everybody's going to want to get it. Some people are going to say, you know, I know, and the bronze, I believe, pays, 60% of your premium. This is if you don't get all of it paid for. That 139 to 400% of poverty. The bronze pays 60%, whereas, the government pays 60%, you pay 40%. If you get the premium, it pays 90%, and you only pay 10%. But it's likely your deductible is going to be higher. On that 60 to 40, your deductible will likely be higher versus your deductible being lower with the 90 to 10, but you're probably paying a little bit more still. So it really is going to be where it's an individual process, sitting down with the in-person assister, sharing the information about your unique family situation, and then looking and saying for yourself, this makes more sense for my family. And that in-person assister will be there to help explain that to them. And I was saying earlier that they go through a week of training. That's in person, on site at the community college that's been shared the modules to teach the individuals what they'll need to know. But there's actually 70 hours in total of training that they'll get from the federal. They have a federal course to go through online. They have a state course to go through online. So they will have about 70 hours of training training in order to get licensed in the state of Arkansas. And the individuals will choose the plan that best fits them. They'll shop the marketplace and they'll see the options and make choices that's best for their family. So open enrollment begins October 1 and it ends March 31st. So please, everybody that you know, tell them please take advantage of this. At least go see. You may not even be eligible at the end of the day, but go and just see whether or not you would be eligible. You can enroll 4 different ways. By phone, they will have an 800 number that you can call, and there will be an assister online to help you step through the portal and get you enrolled. By mail, you can actually request it just to be sent. If you're the old-fashioned way, I still write checks to pay my bills. I like it like that. That's just the way I am. And if you want to do it by mail and send it in and make sure that you have pen to paper, they can help you that way. Or in person, what we've talked about now, there will be assisters that will be out there to help you. And you can do it yourself. If you're computer savvy, you can go online to ourhealthconnector.org. That's the state's portal. And literally get in there beginning October 1 to be able to enroll yourself or even help your loved ones get enrolled. There's one-on-one assistance available that we've already talked about. And if you want to learn more, the ourhealthconnector.org, go on there now. It has really invaluable information. Like, you may not want to wait till October 1. You may want to start researching it now for the people that you have to talk to at the hospital or at the health department if you have a job there and people are coming in, or your loved ones at church or at your social meetings. You may want to know a little bit more. You can go to that website. Or you can call that 1-800 number, 855-283-3483. Does that go to?
It goes to our resource center.
So at the Arkansas Insurance Department,
Yes.
with individuals who right now can answer questions for you that you have. If you leave here tonight and you have a question, call that number and they'll be able to assist you. Terry also is a wonderful resource and will be able to get you to the right person.
And all that information is in the brochure that you picked up. All
Okay.
the contact numbers and the websites, all in that brochure.
Very good. And so that's the end of our presentation. Do y'all have any other questions?
How often will you do it?
It's once a year. It'll be once a year. Or if you happen to, in between, have a family change, a death, then you could call and make that change any time of the year. If you have a baby, then you could add that person any time of the year. Otherwise, it would be the October 1 through, say, if they make it October 31st window. And it'll be just like now, plenty of education and awareness for people to be aware of.
It says dental services on there or oral for pediatric. I'm assuming that is 19 under similar to
Correct.
our kids. And what would that be? Would that be on a scale, just like you said, with the bronze and the silver premium?
60, 40, 90, 10, whatever you're going to pay. Pediatric, dental, and oral is in the basic essential benefits.
Okay.
So that would be covered. I don't know, I think once you get there and you're enrolled, they'll have way more information, but it certainly pays for a lot of the basic stuff.
Right. Similar to like our kids A, our kids B.
Exactly. For adults, that was a huge issue, God, we need adult dental and vision, but it's just not there right now. And so maybe as the years go on, that's something that your legislators will look at. That's something maybe the federal government will approve, but it'll be working with your legislators to get that type of thing added to the plans.
Okay. But still, the dental will be in there for that. And it would also be available in like the sliding scale for families.
Yes, you'll be
that
able
may
to.
Get complete.
You'll be able to purchase separate plans for dental. As adults, you'll be able to purchase separate plans for dental and vision, but it will be an added cost.
Okay.
But it will not be a part of your essential health benefits that's in every package. Right now, in the essential health benefits, pediatric dental and vision is in there.
And it has to be.
And it has to be offered by any of the carriers. They have to pay for it. Like I said, it's going to be the basic stuff like with Our Kids First. But for adults, it's not in the essential, so it will literally be another separate package you have to purchase. And the hope would be that it would still be lower because everybody's participating, but the more people participate, the more.
On the first screen, penalty, you don't, how can that be? I mean, how does that go for, this is say you don't have interest, that statement about penalty?
Yeah, the penalty right now, the first year, it will be through
self-insured is half of what the adults.
Yeah.
Penalty,
Oh,
yeah.
that's- Okay, hold on, just one moment. So the people, so,
But they don't have, they don't file tax.
well, if you don't file taxes, then there are exceptions. That if you don't file taxes, that you won't have to, the penalty won't be applied. If your position is that you really don't have to, you know, not, I'm an American, I don't have to pay taxes on. Not that kind of person. It's the person that really don't have to file taxes that would have the exception. So the first year is $95 is what we know right now. The second year, it goes, that's like they say 1% of income or whatever. The second year, it goes up to $165, something like that, per family adult, and half per the child of that amount. The third year is $600 and something, and then we don't know how far it will go at that point. They're just trying to nudge people. And what we tell people, you know, yeah, you may look and and literally we have that question all the time that says, $95, that's $190. I got 2 kids, that's $80. So $215 a month versus maybe $300 or $400 a penalty. Cha-ching, I'm taking the penalty. And you don't have the ability to do that the first year, the second year, the third year, but we don't know what happens beyond that. But when we tell people if you're going to pay into the system in any kind of way, you might as well get benefits from it. And it's the law, you're supposed to do it anyway. But again, just like with any other law like car insurance, you know, nobody's putting you in jail for car insurance, but they sure will penalize you when you go apply for insurance on that car again and they realize you didn't have insurance for 6 months. It doesn't look pretty. So those are the types of penalties right now that are under the law. Who knows what will happen later as they move forward.
And you think about, if you say you opt to take the penalty, think about one hospital stay. If you don't have insurance, it's gonna cost a whole lot more than, you know, what you pay in for penalties or what you be paying per month for your insurance.
Right.
So, and also, just, those, I found those penalties, it's $95 for the 1% of taxable income, and the second year is $325.
$325, okay.
Yeah, and, the third year is $695.
95. So it'll go up per adult, and there's like $695 per. That's like 1,500, whatever for your adults. I mean, that's just money you're giving back. You're just giving somebody instead of doing what the law says, going ahead getting the insurance. And yes, you're going to be paying, but we all should pay. This is not what I tell people too, because there was a great misconception that somehow this is a big government giveaway. Not when you start paying your premiums every month. It's not. It's a program that requires people to have insurance. Yes, does it think about the indigent and allow some not to have to pay based on income? Yes, like most of our programs do. But it's really one that the majority of that 19 to 64-year-olds, they'll be putting money into the system. That's the only way that it's going to work for costs to go down. And there was a question over here.
The 1964, what if the person falls within that age range, if they're on Medicare for disability, will they be required to do anything different, or will Medicare still be unchanged?
They will not be required to do anything different. If you're on Medicare, this is likely not the program. This is not going to be the program for you. Where it helps with those on Medicare is the the things is that Walmart ain't gonna give you $4 for it. And the cost is exorbitant. You literally have some elderly who cut their pills in half because they can't afford it. And what this law does is it closes that donut hole to the extent to where the Part B will be able to pay for those prescription drugs just as they were the first part of the year. And so that's the benefit to the Medicare, those who are on Medicare. But if you're on Medicare, you don't need to do anything. That already will be there. You don't need to sign a little paper that says, I want the donut hole closed for me. Donut hole is just going to close. And you'll be able to see those benefits when you go to the pharmacist to get your medications. You had a question.
But I was gonna tell you something, I think one thing people need to realize is they're talking about, taking the penalty instead. The 1% is of your adjusted gross income, so that's not just your salary, that's interest income, royalty income, rent income. If you own a business, that income, so it can be a lot. The amount can be extremely higher than, $95.
So, I mean, that's the point. I think that's the point is, why pay the penalty? Because you're going to be paying a penalty but getting no benefits during the year.
Right. I've heard people say, well, it's only 1% of what I make, it's like, no, it's not
Yeah.
just 1% of what you make.
Okay.
It's a lot more than that.
Okay. That's an interesting point because I haven't heard it put that way. Maybe we should kind of get that clarification and make sure. We're learning a lot, you guys, as we go. This is 1,000 pages of law, and I just admire our legislative body. I used to work for Congressman Jay Hickey. Do you all remember that name? Love that guy and see him every now and then. That was back in the 90s, and so Magnolia and all these parts of Arkansas was my little homestead. Some of y'all look at me like, but but so I appreciate so much our lawmakers who had to make this decision. This was not easy in the state of Arkansas. It was a hard fought battle. But both of our Democrats and Republicans, at the end of the day, came together and stood together. And at the ninth hour, literally, they had maybe, say, 74 of the 100 votes, and they needed 75. And there were people like AARP and Children Advocates for Children and Families, and all kind of organizations out there advocating on your behalf, educating your legislators. And at the end of the day, that body really could have said no, like Texas has, like
All of our
Mississippi
border
has.
states.
All of our border
All of
states
our
have
border
said no, and lone little Arkansas is sitting here with a glimmer of hope for about 250,000 people to have insurance just right off the bat beginning January 1. If they know, that's why we're here. We need you all to go out and talk to people about this. It's the law, whether you like it or not. It's the law, and we need those that need insurance to go ahead and get enrolled. So please go tell people, and then another 250,000 or so people who will be eligible for it under the marketplace and eligible for some of their premium. They'll have to pay into the system, of course. Nobody is trying to live off the government. We shouldn't be anyway. So we're going to have to educate the public now and get them aware of benefits that are there. And then stay abreast of it. Talk to your legislators. If you see things that is wrong or is, we know that it's not perfect. And that's what we will be there for, to the commission and all these agencies. We'll be there looking at things saying, okay, we know this isn't working, we know this needs working. We're here from our constituents. These are the questions that they're asking. Our constituents are